Chris Goldsworthy. I've been working in the realm of musculoskeletal rehabilitation and pain medicine. Neuroscience is my particular interest. It's what I used to teach as an academic. I still teach my own courses, particularly in methods of manipulation of nerves and rehabilitation, my particular interests. I've also got another interest that I work clinically with, and it's more systemic conditions, particularly everything that relates to the brain to gut axis or gut to brain axis. And laser is a big part of that for me. So I will be explaining about that today when we talk about brain treatments. The other areas we're going to work on are going to be endometriosis, skin conditions broadly, fungal nail infection. It's a topic that was very important to add in today, is relevant to podiatrists, and the microbiome. I might have missed something there, but we'll cover it all today. And today is a day for questions because it's a broad topic. And today's topic really is everything not joint and musculoskeletal, basically. If you want to ask me a question about any particular condition, any particular region of the body, I'm happy to have a discussion about it. I'll leave some time for that. I will cover as much as I can about the topic. The other thing about today is don't forget your parameters in general when dealing with pain. Pain is all about overstimulating tissue, and repair, activating a repair process, is all about understimulating. So you need to have your protocols pretty clear. The reason you would use an LED, rather a laser over an LED cluster, is purely to do with depth. Laser gets deeper and a more concentrated energy. So it tends to work faster if you're trying to have an analgesic effect. It's also important to note that when a laser is applied to the body, it doesn't maintain its beam when it goes into the tissue. It does distribute outwards, so it forms a wider beam. As the light penetrates, it starts to scatter. Okay, so when you apply a laser to a region, you look at it like a thumb, 1 to 2 thumb widths around that point you'll be affecting. Okay, so that's important as well. When we're applying it to regions of the body, particularly the brain, the hertz or the frequency does really matter. On the Polaris, you can change the frequency, the hertz, and you'll need to be able to use 30 hertz and 10 or 11 hertz. Those are the particular important parameters for the brain. Okay, we're going to look at that today. The other areas, the contraindications, we've talked about this each week, over any area of malignancy and the abdomen of a pregnant woman, and of course, directly into the eye so that there's no retinal damage. The caveat to the eye is that with an LED light, you can use it over the eye because there's lots of different treatments for eye conditions that you'll need LEDs for, but that's a particular speciality. Standards, refer back to this when you are looking at your state and what type of profession you are. Okay, so as we go along, put in the chat above the PowerPoint, you'll go up and you'll be able to see that you put your questions in there. Ursula, I'll get to yours soon. We'll get to the state-by-state thing later if we can. We'll stick to the conditions first, if that's okay. Just makes it a bit easier for me. And then ask questions about each condition as we go along, and I will stop and start. If we need to wait till the end, then I will, because if it's getting a bit overwhelming for me. Okay, but put your questions up in the chat, okay? And I will endeavour to answer them as we go along. So fungal nail infection is our first topic. Now, I've got this study off ResearchGate. This was a clinical study performed on 72 patients, and all of which experiencing this onychomycosis, basically a fungal nail infection, chronic fungal nail infection. And with all of them, they had 4 sessions with 1-week intervals, during which all infected nails were irradiated 3 times with a laser light, and the whole plate of the nail was covered by the laser. So when you look at the fluence, this is a 35 to 40 joules per centimeter square. You can see that on your Polaris. You can adjust to 35 to 40 joules per centimeter squared. And that was applied for 35 seconds on average. Sorry, 35 milliseconds to develop a nail plate. That should, I've actually missed, change that msec to seconds, please. 35 seconds, so that the temperature of the nail plate increases to 45 degrees. The aim is to heat the tissue up in order to kill the fungal infection. So this was performed at 3, 6, and 9 months, any follow-up. And they found that by the end of this course of treatment, 95.8% of patients were cleared of all fungal infections. So the key to understanding this is that there was a high dose of laser applied, and it was all about heating up the nail plate. Okay, so protocol time, 35 joules per centimeter square for 35 seconds with intolerance. Now, if a patient can't tolerate it, you take breaks, go in and out. You can repeat this more than once a week. They did it once a week. In fact, more than twice a week may be of benefit. We just don't know as far as clinical research is concerned. And hertz need to be above 150. Okay, so with your laser, the high-powered laser is what you'll be using. You can use it at a 4 or even 8 watt level in order to get the heat up. Okay, but you'll be able to note the amount of joules per centimeter squared based on what you're going to go into the manual settings of the laser and change it up there. Most lasers allow you to see the joules per centimeter squared, and it shouldn't be a problem finding it. I've got an older laser that Asta used to sell, and that one also allows for that as well. So I can use a low-level laser as well. If you prefer, you can use that as long as you get the 35 joules per centimeter squared. It'll probably take a bit longer than 35 seconds. The high-powered laser is much, much faster. Okay. Is there any questions about the protocol? Question from Ursula LL. Are you mean low-level laser? Question? Ursula's asking, can you do this with LL? Yes, yes, you can do it with low-level laser. It's better with high-powered laser, but you can definitely do it with low-level laser as well. And the Polaris, you can adjust. I'm able to adjust the laser to 100 milliwatt laser by changing the density of the power to a lower percentage. So you can get it from the standard low part is 500 milliwatt laser. That's the lowest at normal energy density. You lower the energy density, you can get it to 100 if you wanted a lower level laser. Like 100 milliwatt laser is a very common laser. Some are even 30 milliwatts. I'm not a big fan of the ones that are under 100 milliwatts. But you can also go high, go to 4 watt or 8 watts. And that's fine too. Just again, it's still the same joules per centimeter squared. It doesn't change. Okay. Right, well, today's big topic is going to be the brain, I think. we'll do that in a moment, but the skin, let's just talk about that first, sorry. So coming off the nail bed, let's move to the skin. So there are a variety of skin conditions that you may decide to use laser for. One is not really a skin condition, but it is involving the skin, and that's a wound. Okay. Now, wound care is all about low intensity laser. You can use the high intensity laser, but you must use it with the same low input of light and energy. Okay. So if you say use a high intensity laser over, say, a normal low level laser, that low level laser will be held for much longer. So about 30 seconds. Whereas the high intensity laser is about 10 seconds. It's very short. Okay. But generally what I would recommend is you reduce the intensity of your laser, the Polaris as an example, to 100 milliwatts. You can do that by reducing the laser in itself and then the density percentage, and you'll be able to get to 100 milliwatts. And then you can apply the laser around the wound. And then you can do it for about 30 to 40 seconds. Okay. The key is regularity. It's not about how much you do in one go. In fact, it's the opposite effect. If you do too much, you won't have anywhere near the wound care effect that you want. You want to go low intensity, lower frequency. So I'll come to that in a moment. Now, the other one, this paper on the right talks about low-level laser specifically. So in it, that it's consequent electron transport, ATP, nitric oxide release. We talked about that in week 1. Blood flow increases, reactive oxygen species increase, diverse signaling pathways are also activated. Most of this is all about increasing repair rates. Stem cells can be activated as well. There's some research into applying laser over areas such as long bones, so like tibia, the greater trochanter, iliac crest, sternum, areas where you're going to get mesenchymal stem cells, and it activates the production and release of them. And those are protocols that we're not covering much today, but those are important to note when you're also trying to increase healing, because the mesenchymal stem cells can be differentiated into different types of cells in the body that might need repair. So you can apply a minute of laser or less. 30 seconds is actually enough. 30 seconds over the tibia. You might do 3 different points up and down the tibia and 3 different points up and down the sternum. And that's sufficient to, at 100 milliwatt laser, that's sufficient to activate mesenchymal stem cells. So that's an additional thing that you can do. You don't have to just do the area. You can also add in a treatment that covers mesenchymal stem cell activation protocols. In dermatology, low-level laser is beneficial for numerous conditions, according to this paper. Wrinkles, acne, hypertrophic scars, healing of burns, which makes sense again with wound care, all of which are basically to do with the same mechanisms which laser helps to repair bone, helps to repair tendon, etc. All the same mechanisms involved. So the other thing to consider is just inflammation in the skin, not necessarily damage. So things like psoriasis and acne, all of which can be approached with laser. I'll just come back to it. Yeah, so the thing, yeah. So this is my protocol for skin disorders in general, is to 30 seconds per point at a 30 hertz, quite a low frequency. And that's for 100 to 200 milliwatt laser. And this is repeated twice a week. You can do it once a week. Generally speaking, though, I recommend more than once a week to get on top of conditions. Psoriasis does respond. I remember it took one case 6 months of weekly treatments to completely resolve psoriasis and for it to never return. Another case took a year. of fortnightly. And another case was very, very minimal. It was just a region on the hairline. And that took about a month to completely resolve. Eczema is a little bit trickier. It comes in waves. It doesn't always present when they come in. Often they say, I get it here and here, and you apply it and you have to wait and see often. But I do think that for eczema, it's not quite as good as psoriasis. But if I was to have treated 100 of each, 100 patients of each type, I'd probably get a better answer as to how effective it is. It's not, I can't find a paper on eczema specifically. Psoriasis, there is some preliminary evidence that it works very well as long as we do consistent treatment over a long period, which is good for something like psoriasis, for skin conditions such as psoriasis, that generally are being used, like steroids and all sorts of other things are being used to offer not much effect. And they do more harm than good long-term, some of these drugs and topical skin applications. So acne is another one. Acne, though, has very specialized research where other lights like blue and green may be of more benefit. It's very hard to say at this stage. I find that the skin research is a little bit early days. So I've personally had good experience treating acne. Acne tends to respond well within 3 visits, and the likelihood of it reoccurring gets less and less. That's my experience. Anecdotal as it is, I've found it to be an effective tool at treating acne, and that's with near infrared and infrared lights. Okay, all right. So the big one today, for many people who haven't talked about it before, is a thing called transcranial photobiomodulation. In other words, crossing the cranium light therapy. It can be done with lasers and it can be done with LED probes, LED clusters. They're like little clusters of LEDs, normally 30 odd little bulbs. Both are useful. I use both. I use LED light and I use laser. Laser is more specific and depending on the wavelength can get deeper. So anything near infrared and above, so near infrared and infrared penetrates deeply into the brain. Red is very superficial. So red light in the 600 wavelength band, that area tends to be more affecting the blood vessels of the brain, not the actual brain tissue specifically. So you can use light therapy in 2 areas of the brain, one, overactive areas and underactive areas. Overactive areas aren't necessarily highly functioning areas. They're areas that are overutilizing ATP and blood flow because they haven't got good capacity. You'll find that an area that's struggling tends to often be overactive. You know, a brain gets very overactive when learning new things because it can't do that thing very well. So brain regions tend to become overactive, and that's an aberrant activity in the brain. And other areas can be underactive and not following their normal processes. So for example, they don't have enough ATP, their blood flow is diminished, they don't have enough neural connections to other areas, the rate of sending out signals to other areas is reduced. So they're basically, you would say, I'm trying to make it not so complicated, the wording. When a nerve or a neuron sends a signal, it has a rate at which it sends that signal. Let's just, for argument's sake, say it's 100 pulses per second or 100 pulses per millisecond. A reduced rate would be 30, right? And an increased rate would be 200, as an example. So an area might have overactivity for whatever reason. That most of the reasons we don't know. We don't understand why areas become overactive and why that manifests into these X and Y symptoms. But there is a good known pattern of underactivity and overactivity in conditions such as depression. And I'll talk about that, okay? There is a definitive underactivity in the frontal lobe, in certain regions of the frontal lobe, in so many of our conditions that we see in clinic that are comorbidities to chronic pain cases. Depression, anxiety being one, two. Any condition relating to delusions, any condition relating to attention deficit, any conditions relating to social inappropriate behavior patterns, inability to do executive function. In other words, planning ahead. Can't plan, can't maintain focus, things like that. These are all frontal lobe problems, hypoactivity and hyperactivity in certain areas, possibly compensatory. So the frontal lobe is a big area of importance when it comes to using light therapy on the brain, because it's the seat of our personality and our consciousness. It is the seat of our behavior. It is where our motor function is performed and executed from. It is also highly connected with our reptilian brain. It is highly connected to our emotional center. It regulates our emotional center, not in isolation, but highly associated with that. It is integrated with the temporal lobe and the hippocampus, which is involved in memory formation. Without the frontal lobe, you can't form memories either. Okay. No memory is a memory without context. Frontal lobe gives context to a memory. Parietal lobe is highly integrated with the frontal lobe because the parietal lobe is our sensory cortex. So all of our touch and perception of where things are touching us. My hand is touching, my finger is touching my hand, and that comes up in the brain. So all of these things matter. All of these things matter as far as integrating regions of the brain. So if we apply laser to the parietal lobe and the frontal lobe for someone who has sensory motor integration problems that can often be seen in neurodevelopmental disorders, ASD is one of them. There are a bunch of other motor related ones and speech, but also cerebral palsy. Anything where the brain has been damaged, you'll have sensory motor integration problems, perception turning into acting and behaving with a motor output, whether it might be speech or movement. The cerebellum is the center, or at least partly the center for balance and equilibrium, and that area can be irradiated as well. So nearly always we're applying 35 to 45 joules per centimeter squared. Energy density depends upon your laser. You can still use a 500 milliwatt laser, but I would use it at more 100 milliwatts, maybe 200 milliwatts. And you're using different frequencies. So 10 or 11 hertz, 11 is good, and 30 hertz. Now, the reason you would use 11 is to calm an area. Generally speaking, it's a bit vague, I know, but for anxiety, I would use more 11 hertz over the frontal lobe, whereas for depression, I'd use 30 hertz. And these are very preliminary numbers as far as research is concerned, and that's why I believe some papers and some researchers don't get the results they're looking for. They're not using these very specific frequencies that the brain seems to respond to. Some papers have shown that anything above 30 hertz has a nil effect on the brain. There's not much change to cerebral blood flow or function, and anything below or between 11 and 30 doesn't seem to either. There's this sweet spot at around 10, 11 hertz and 30 hertz. Very strange. Any questions? I'm about to go. Let's have a look. All right, so there are studies done on Parkinson's. Some of them are a bit peculiar. There is a really good one done in, I think it's Sydney University, done with a type of LED device that was basically homemade. They're all being produced out of a men's shed in Tasmania. I have a few patients that use them. It's basically like a little hat that sits with an LED cluster around the whole head. Not very specific and actually not very close to the skin. It's using infrared and red light. And they did a study on it would be no more than 10 Parkinson's patients using it. And they did it for a fair amount of time. I can't remember if it was more than a month, but it was a fair amount of time. Regardless of the time, they all showed significant improvements in gait function, and they had reduced tremor. And some had changes in their cognitive function as well, which makes sense with the increased cerebral blood flow. So that's a great study, that one. And there's another one where they've done it over the abdomen. The light was not applied to the brain, it was applied to the abdomen. And that showed some improvements as well. So MS, I haven't seen a study done on MS. MS, I would say, is likely to improve. Dementia is far clearer to me. I have multiple dementia patients showing some increased cognitive function at the very least. Ursula asked how to penetrate the bone and the hair. Oh, it's not a problem. The hair is a problem mostly, but when you're dealing with the frontal lobe, you're applying it below the hairline. When you're dealing with the motor cortex, you do start to have to part the hair. So lasers are much easier to deal with hair because you can part hair and then apply it between the hair that's parted. When you're using a cluster LED, it's much harder, yeah, because hair will cover. And so you do theoretically have to apply a longer burst of laser for hair. I mean, it's easy for me, but for others, it's not so much the case. So depending on the hair density, I would increase the amount of time that you do it. And that's very hard to give you an answer as to what that is because we don't know. So thick hair is likely to take up a lot of that light. So you would need to increase it probably by 2 times 2. All right. So let's look at a couple of studies. On the left, this is a meta-analysis. And basically what it shows, this is a very recent one, 2001. There's no homogeneous results. There's no consistent results in RCTs for brain laser, okay? The evidence-based decision-making, as a result, there's no definitive therapeutic application, according to this. There is actually some, and the key here, if you read through the whole body of work, of research, is that people are doing all number of things. They're not consistently using the 30 and 11 hertz or 10 hertz. 10 is fine, just FYI. But the 30 hertz, and the reason I think is that they either don't know, or they think that standard protocols that you would apply to the rest of the body are sufficient, which they're not. Some are using red light, not near infrared and infrared. And I wouldn't bother with red, to be honest. Infrared is far more likely, near infrared and infrared, far more likely to have any effect on the brain than red. And so remember that a lot of the reason why papers don't come up with a clear answer as to whether it works is they use the wrong color, or they use the wrong frequency, or they overstimulate it. That's what I've noticed. It's overstimulation or under. I mean, like we said, the hair can get in the way. There's not a clear science as to how to apply this. But when you have to trial sometimes. There's no harm in overstimulating the brain with light. The worst I've ever seen is someone gets tired. And it's hard to say whether it's from lying down. You know, it's not clear whether that side effect of tiredness post LED or laser on the brain is from lying down in a room for half an hour or from the light. But let's just say this from the light. Tiredness from the brain being stimulated is not the worst thing, by no means. And it may actually be an indicator of it working rather than it not working. So clarity over this would be that long-term use of LED or laser light on the brain is showing good effects. And it's definitively going to improve brain blood flow. That we know. We know that it increases brain blood flow, as a paper I'm about to show. On the right here, transcranial systemic photobiomodulation for major depressive disorder, systemic review. And in this paper, we look at basically a database of different papers. There are many different studies on major depressive disorder and LED and infrared, near-infrared lasers and things like that. Some of them apply it just anywhere. And it's quite frustrating. There are key areas that it needs to be applied, okay? In my opinion, and we'll talk about that today. And that's the way that you get effects. Just generally doing it throughout the head, I'm not convinced that's the way to go about it. But a lot of papers just do that. So just keep that in mind, that papers, some researchers are not specific and some are. The specificity of it does matter, in my opinion. So in this paper, they do recommend the use of it for major depressive disorder, but they're still unclear about the ideal stimulation parameters. The safety profile of it is that basically you can, if you do it in a way that is research-based, like in a randomized controlled trial, you can get side effects, most of which are benign, okay? The ones that I've noted are mild nausea, tiredness, and headache. But headache is extremely rare. Tiredness is the most common. And even that happens 1 in every 20 or 30 cases. All right. On the left here is transcranial photobiomodulation in the cognitive rehabilitation of patients with a trauma to the different brain regions, basically. So the results found an alteration in cerebral blood flow, as well as a consequent increase in cerebral oxygenation. Incredibly important when you're trying to rehabilitate someone. And this of course correlates with increased cerebral function. So if we can use light therapy in the brain to increase blood flow, what we can do is use that as a hack, right? Conjunction with rehabilitation. Someone is being rehabilitated for post-stroke, as an example, or head injury. Doesn't have to be, could be a healthy participant. And we're improving their gait, right? And you apply the therapy to the brain, probably at about 30 hertz over the motor cortex and the sensory cortex, and also probably the frontal lobe, most of the frontal cortex, prefrontal cortex. The motor system is part of the frontal lobe. And then they go to do their rehab straight after that. It's like a priming. It's an incredibly important part that could be integrated now into a lot of rehabilitation clinics. I find it effective. I have numerous patients that go to their rehabilitation straight after the consult. And even if they don't, the next few days is good as well. There was a study done where it found that applying light therapy to an area that was about to be surgically treated, participants that, I haven't got the paper with us today, but participants that had applied laser prior to the surgery, 2 days prior, had a much faster healing rate to their wounds post-surgery. And that was applied before the surgery, 2 days before the surgery, twice though. 2 days of 2 treatments before the surgery. And it's something to do with a mast cell response. So the mast cells are hyper-responsive after light therapy. Interesting. It's being coined as mast cell priming. Interesting idea. And it's something to consider. Before a surgery, applying light therapy, LED laser, or a laser and LED therapy to an area that will be cut open in a matter of days. So the other one done here was on healthy young adults, and its conclusion was we demonstrated a significant beneficial effect of transcranial photobiomodulation on cognitive performance of young healthy individuals. There was so much different data, so it's very hard to take on like the different age groups of the younger adults, different parameters were used. It's very hard to come up with a clear answer. This is a systemic review and meta-analysis. You're going to find studies didn't all have the same approaches. So that's why we really need to come to a clear approach. I had my approach, okay, but it's not clear in the research what the approach should be. You will either take what I say as gospel, play with it, see what works best for you. I'll give you a couple of variations on the facts that I use, on the parameters that I use, and then you can trial and error is the key with this. And I don't think that the same protocol is going to work with every single person. Just like shockwave or laser doesn't always work in exactly the same way with everyone. For pain, as an example, sometimes you've got to go less. I'll talk about that later. All right. So when you're lasering, there are two different approaches to the brain. You apply it either over the suture lines in order to get through sutures, as if possibly they have a higher penetration because they're sutures. So just be aware of that is a very common approach, is that you'll apply it to the suture lines. Many groups of researchers do that instead of over the actual bone itself. I think both have their place. I do both. So 30 Hertz, this is an example of what you might do for someone with a rehabilitation protocol. Someone who's trying to improve their motor function. You're going to apply it to the coronal suture, because the coronal suture is where our motor cortex is, and come back. Our motor cortex is just sitting here at the front of the brain along that suture line. Okay, so if we want to affect motor function, we need to go there. Now, remembering if it's the left side of the body, it's the right side of the brain. If it's the left brain, it's the right side of the body. Okay, and that's what you've got to always get right. Don't be treating the same side as if a person has motor function problem on the left, it's the left. Sorry, it's the right. Let me rephrase that. If it's the left side of the body that has a motor deficit or is not performing something properly, weakness in a muscle specifically, it's the right side of the brain. Okay. Now, this approach affects grey matter specifically, not the white matter. The white matter is much deeper and it requires a longer irradiation. I'm not really covering white matter irradiation today. I'm covering mostly grey matter. And you'll find most of the time that's what you do. You don't do a lot of white matter unless you've had a white matter stroke, which can happen. You know, well, it happens in every stroke, but the white matter pathways from one region to another in the brain, they're much deeper. So you need to consider basically doubling the time in which you irradiate to get enough energy there. Okay. You apply 45 joules per centimeter squared to the brain through the skull, and you're not going to get much more than 1 joule into the brain itself. Okay. So it's not a good rate of transfer. A huge amount of it gets sucked up by the actual cranium. That's why we do it for so long. And the 30 Hertz and the 11 or 10 Hertz are important, but 30 Hertz is important for motor cortex because we're increasing its function. 30 Hertz tends to be an elevator of function. 10, 11 Hertz is more calmative effect and tends to be used more for anxiety disorders. This is to be I've definitely found that more effective. for anxiety. Okay. Now, this is your reference to where you go on that suture line. On the left is our motor cortex. And this motor cortex shows that the knee and the leg is around that central line. So you're going to be affecting more of on the sagittal line where you want to affect lower limb. Start to go up the torso into the hand, and that starts to go along the curvature of the brain up into the face, tongue at the bottom. Okay. So hopefully everyone understands this image. The motor homunculus on the left, which is where the distribution of neurons for different regions are in the motor cortex. Questions? Ursula asks, well, how long do you apply? Look, Ursula, the question of minutes is all relative to the amount of joules per centimetre square. So, for example, if you've got an LED cluster, for example, and it gives off 200 or 300 milliwatts, well, it's going to take less time than a 100 milliwatt laser because the amount of joules per centimetre square is higher per minute. So, but also consider that the wider it is, the less specific it is. So I know that's not that clear, but a laser that's used on a suture line is very specific. And if you can look at your laser and make sure that it's at a relatively low milliwatts, 100 to 200 milliwatts, you can adjust the Polaris to that. And then what you can do is apply it for the said manual mode of 35 to 45 joules per centimetre squared. I know it's difficult, but you can't use the programs on the Polaris because they are musculoskeletal programs. What I'm teaching you is outside of those programs and very specific parameters. You'll need to be able to edit the joules per centimetre squared. On an LED cluster, on average, it's about 4 minutes long. I can't say how many it will be at 200 milliwatts, but you would need to check on your... I have specific protocols I use for my specific machine, and check on yours, and you can always ask more questions about getting that exact parameter. It is very... I've done it on the Polaris, and you can do that. It's not a problem. Okay. And the Polaris is what Asta sells. Okay. So when you're dealing with depression, you're going to need to be affecting different brain regions. But the key area of concern is the DLPFC. That's the dorsolateral prefrontal cortex. That area is hypofunctioning, hypoactive in depression. And it's highly associated. So when you see damage to the dorsolateral prefrontal cortex, or you see an area of reduced blood flow, for the same reason often is the case, it doesn't have to be from damage. It's highly correlated with depression. So that doesn't mean it's the seat of depression. It just means that it's involved in the aberrant circuitry of depression. So because it's involved in control of emotions, right? So dorsolateral prefrontal cortex is going to help control unwanted behaviors and emotions. The VMP, ventromedial prefrontal cortex, is involved in autonomic responses as well, regulation and modulation of pain and aggression. And so that's highly associated with, and sometimes that area can be hyperactive, not underactive. But I do find that no matter what you do, when you're treating dorsolateral prefrontal cortex, you're going to get irradiation of both areas. So you can imagine that these areas are highly involved in chronic pain cases as well. So what I tend to do is irradiate dorsolateral prefrontal cortex. On the left is more important than the right, but left and right, and we'll look at where you do apply that. Here is a brain image, and you can see, this is in French, sorry, but the dorsolateral prefrontal cortex here at 9, 46 and 8. And here it is again in the blue. Okay. Now, what I will do, just censor. Lee asks a question, can you do damage if you overcompensate the time? I see. No, if you're using 100 to 500 milliwatts, there's no heating effect, and you've got to keep it to that 35 to 45 joules per centimeter squared. And I get that if you have hair in the way, you'll want to increase it probably to 75, 65 joules per centimeter squared. That's fine. You won't damage the brain. It's definitely not the case. You're not using a heated version of the laser. You're not going to use the high intensity laser for this. You're going to use the low. LEDs take a lot longer to penetrate enough energy. So lasers obviously penetrate faster and deeper. In all the clinical trials, there is no brain negative effects. Anything that's a side effect always occurs short term, it's resolved within the hour. And I've used it clinically since 2014 on the brain. Not one single case of any major side effects that lasting more than, for me, an hour. And that would be fatigue and nausea, only two. All cases I've ever experienced have improved cognitive function, cerebral blood flow. The likelihood is actually that even when you get, say, 70 joules into the brain from the outside through a laser, you're not getting much more than 2 joules on the brain. Very minimal light and very minimal energy. So if you're worried, then apply it in 2 doses. Apply it for 4 minutes at that, if it's 4 minutes to get that many joules per centimeter squared, and then wait 10 minutes, reapply. You're not going to cause any problems regardless, but that would be a safe go. Okay. Now, what I want to do is I want to bring back my video. All right. You should be able to see me. Okay. Now, I want to just demonstrate something. Hang on. Yeah. I want to just demonstrate the approaches of where you apply the light. Okay. So this is just using one of my particular lasers. Now, on my frontal lobe here, we can find my suture there. That's my sagittal, sorry, my coronal suture just here. Just look for my receding hairline, and then you can apply a laser through that line there, okay? The dorsolateral prefrontal cortex is generally found at the curvature of the head as it goes back. So around here, you can see it's on a diagonal angle, and you can apply it to both sides like that. As I go up, it's on the curvature of the head, and it's found halfway there and not in the front, but as you go back slightly, but not as far back as the suture. So that's motor cortex. Okay. So that area is the area for anxiety, depression. Dorsolateral prefrontal cortex. Those two sides, boom. It's as if you're going diagonally into the brain on both sides. The left is actually the most important, but I would include the right. Some people's right is more negatively affected than the left, but more on average, it's the left. And that's what the studies would show, the dorsolateral left side. The other area of concern might be sensory. So you can apply it to the parietal lobe back here. You might add it to the temporal lobe, which is on the temple bone above the ear. And that one's used for memory, increased memory formation. It's inexact because you kind of want to just cover the area a little bit. You can do 3 different points, make sure. But if you've got a laser of that kind of aperture, expect that it's going to irradiate that much inside. Depth, that width. It's not just going to go in and irradiate just that point. It's going to irradiate a width around it, even bigger possibly. Okay. Less is more though when it comes to the brain. The tricky thing is just getting it through the hair. Okay. Now, I've mentioned the areas of concern. Let's talk about, and I'll answer some more questions about that in a moment. All right. Let me just get rid of my video. So the other area is the microbiome. So this is very simple, but basically we've found that when you apply laser to the microbiome, you have an increased number of beneficial bacteria. The other positive effects on the microbiome is that it's associated with a decrease in inflammation with those increase in beneficial bacteria. So this applies to inflammatory bowel disease or to dysbiosis of the gut, possibly even functional disorders, disorders relating to diarrhea, constipation. All of these may be affected by an aberrant microbiome. But I would also add that often the brain function is implicated with microbiome abnormalities. When the brain is not functioning optimally, you'll find that in the papers that do this kind of research, when they have damage to the brain, the microbiome changes immediately within the hour, or within seconds, sometimes within seconds if they can test for it. So that means the microbiome is a reflection of the brain function. So we can possibly treat the brain through the gut, but we can most certainly treat the gut through the brain. So when you're doing the work on the brain with a laser, you can treat the gut. It's not an exact science where that would be applied. I would say the best thing is the frontal lobe, because the frontal lobe controls emotions. And the gut is a reflection of our emotions. So often, the behavior of the gut is a reflection of our stress levels and the strain in which we're under emotionally. But that's not that controversial. So protocol applied microbiome inflammation or GIT. So it's to reduce inflammation. Remember that. So it's a low hertz, 1 minute per point. It's a bit elevated in its minutes from 30 seconds to 1 minute because of the depth of the structures. Okay. So I go a bit longer. You can go up to 1.5. Most of the time, you're not going to overstimulate. It's very unlikely. And the worst case scenario of overstimulation is that you're just reducing pain. You're just not really having an effect on inflammation as much. Okay. Cluster is often more useful because you can cover more area, particularly when it comes to structures such as the small intestine, large intestine. But you still will find that the laser itself is effective, and you're probably more likely to use it because it gets to every area that you need. You don't need to keep swapping around. So if you're affecting the microbiome, you're predominantly going to be affecting the colon, okay? Because most of the microbiome is situated there. Although there is bacteria everywhere through the GIT, including the stomach, normal beneficial bacteria, you need it to be there. So you can apply it pretty much anywhere, okay? Areas of irritation are based on palpation. You might also have a scan done. They might have had a colonoscopy. They might have had endoscopy, and it shows, oh, you've got areas here, here, and here, and you've got inflammation and irritation. So those areas may be affected with laser if you know how to palpate for them, okay? Palpation of structures in the abdomen is outside of the scope of this PowerPoint, but at least you'll get the idea. Now, lastly, I want to talk about endometriosis. Now, in this study, a high pulse laser was used, and it was found to be extremely effective for pain alleviation, also reducing adhesions, improving quality of life in women with endometriosis. It was done on 40 different women, and their approach is not specific, even in the paper, but most of which is an overstim, not an understim. So it's not about reducing inflammation in its approach, it's about reducing pain. So that's the approach of this study. I think the best approach is you can apply what would normally be about 1.5 minutes per point which is about 9 joules. 9 joules over with a laser. That's 100 to 200 milliwatt laser. And you do it over areas, these black marks here, these areas, ovaries, uterus, bladder. Bladder's a bit lower, of course. Often endometriosis is present through all these areas. Often the colon. I've taken off part of the colon here, just so you know. Sorry, part of the small intestine. And any number of areas may have adhesions. So you need to be quite liberal where you apply the laser. It may not just be over ovaries, uterus. It may also be colon and bladder. More often it's bladder than anything else, but those areas are often involved. So just saying that the research points towards high-powered over low level, but I've traditionally used low level with great success as well. Okay? Questions? Ursula, is that, when you say morbus Crohn's, do you mean Crohn's disease? Yeah. Yes, Crohn's disease and ulcerative colitis are the two inflammatory bowel diseases I'm referring to. So that's correct, yes. The laser can also be applied to the esophagus. So when I say the GIT, I mean everything. Yeah. They all apply it the same way. They're applied with a lower dose. If pain is of a significant factor, and pain is more important than inflammation, then you can apply a high dose to the area, just like you would with endometriosis. Okay. And I would also recommend that to consider using shockwave. If you, I think I covered a little bit of this in my shockwave course. Shockwave is incredibly important at dealing with adhesions in conditions of inflammation of the viscera and any number of conditions, including endometriosis. Any other questions for me today? Mm-hmm. Well, either way, think about a condition that might come up. There are plenty of conditions. Inflammatory bowel disease is very common. You've also got functional disorders of diarrhea and consistent constipation. Those ones do respond, but they aren't always very clear why they have them. A lot of it is dietary, a lot of it's emotional, and that's why you need to consider a holistic approach, not just treating the gut, treat the brain. This is why I said I'm a brain to gut axis clinician. I really like to focus on treating the brain as a capstone, and then treating everything else secondary to the brain. If you treat the brain as number one, my experience is it's a better result, because the brain controls behavior. It controls, you'll find, the behavior of the gut more than is let on. There's a lot of discussion about this gut brain. The gut brain just really can't behave normally without brain input. So you've got to get onto the brain function first so that the gut brain can function optimally by itself. I'll just bring my video. So if you've got any real big queries and unsure of anything that we've talked about today, you can always send a message to Asta and they can forward it to me. I think that this protocol of treating visceral problems and brain and skin is a real area that is still new. The brain laser is not that new as far as research, but it's still a new area of research. So some of the protocols will differ. You'll see all sorts of protocols out there. I've tried to make it what I've used and what I've found to be successful. So completely transparent about that. Not all of mine are based on research only. It's also my experience. And so that's my protocol approach, is to combine the research and experience with trial and error. And this is what I've come to be effective. There will be caveats to that, as I said. I'll get to Asta to answer the question about attendance certificates. Paul or Lee? that can answer that.
Sorry, Ursula. Yeah, yes, we will be able to have those sent through to you after this webinar. So keep a watch on your email box.
Cool. All right. Well, I hope that's been fun today. I mean, like, once you get started with this stuff, it's pretty cool. I would always look at every case holistically and always treat the brain as number one. All right. I hope I covered everything well enough for everyone to understand it clearly what to do. There's always, every course I've ever done in my entire life, there's always, I can show things a million times. People always ask a question again, which is fine, just to clarify and make sure that they're doing things correctly and to the protocol. So if you're unsure, send us a line and we'll try to answer it. Okay? All right, I'll finish up. Thanks, everyone.